guys, I'm back with a 16-week update following my pec major tendon reconstruction with an allograft or a cadaver tendon augmentation. So really what I want to talk about now is kind of like zooming out for a 30,000 foot view and then hone in. So first things first is I kind of think as if I were on the other end as a therapist talking to myself, a patient. And the first thing I'm thinking of is like, okay, are we trajectory wise, are we behind schedule, on schedule, or ahead of schedule? That would be my first thing, because depending on where we are, I would try to like reverse back to the mean. If we're ahead, I would say, okay, we have a little bit of buffer, and if we're behind, I would say, okay, what do we need to do to get us back? So as far as where I am, earlier on, I felt like I was ahead of schedule. Now, I kind of feel like I'm on schedule / like inching to the head of schedule, and I'll show you why. So, as far as like to give you an update, as far as range of motion, I'll show you my good side, right? So this is full range, okay? As far as flexion, coming behind you, right? And then coming here, 90-90. Now this is so important because this is gonna allow that full pec major motion, right? And then having come slightly further behind like this. And you can even see, even through the shirt, how there's a little bit of stretch, okay? That's my good side, that's my right side. Left side, coming straight up, I'm here. So as you can see, I still have a few degrees to go, okay? And then coming here like this, I come like that, okay? Same thing, a few degrees to go, I come here like this, right? So I'm just a little bit limited. Now, I'll go through in a minute like other functional things and things that I see about where, where I see the actual limitations of day-to-day life, activities, and things like that. Now, why I say I'm like on schedule. So as far as being on schedule, you're realistically what I would expect for somebody like me, somebody who's active, lifter and everything, is to have that full range between 4 to 6 months. Now that is so big because it differs depending on what the person is really interested in. At this point right now, where I'm at and where probably 99.999% of my patients would be, is where the shift has gone from range of motion being the most important thing to now strength, stability, and coordination within the available range. I'm gonna get a little bit more bang for my buck trying to do motion and range of motion exercises, but far more I feel, and we also see this as in the therapy world, that last bit of range of motion is limited more from like protective guarding, the body kind of protecting itself, limiting itself, getting into those positions because it really doesn't feel quote unquote secure. It doesn't feel like it can get there safely. So if we instead don't try to push beyond the barriers, but make us feel most comfortable within the barriers that we do have, it really allows our body to kind of open up the barriers a little bit more, which thus leads to more mobility. As far as like time frames and healing, right? On the front end, if this is like a time and this is a healing, it's very parabolic, right? It like really amplifies where after, the first probably 6 weeks or so, I started seeing a lot of heavy changes quickly because I could start doing more and more and more. Once you get kind of like that 12, 13 week mark, everything starts to kind of slow down and now it's more like this, okay? So now I'm on the tail end. So on the front end, parabolic. On the tail end, it's more of marginal progress. So if you imagine like this is the ceiling, it's like here and it's just inching. Now, quick tangent, what we find in the therapy world, a lot of people, patients, they like that parabolic move, and as soon as they quit seeing that parabolic move, they want to stop. Whether they think, hey, I'm making good progress, I think I'm going to maintain this trajectory, I'm going to finish on my own, or B, they're like, I'm at a good point and I don't really need that last bit of help. In many cases, this is when the phase 3 of rehab. The way we do it, we have 3 phases. We have relieve, rebuild, resilient, where relieve, goal is to focus on relieving the pain, relieving any restrictions, things like that. Rebuild is like rebuilding the tissue back up and what you would normally think is like your quote unquote your normal therapy. That range of motion, strength, and stuff like that for day-to-day activities and things like that. And then last but not least is resilient, which allows us to put your joints through any position at any given time with any amount of load in order for yourself to become resilient. And that is the phase that I'm kind of like transitioning into now, and will probably be there for the next two months or so. So I want to talk a little bit about the healing. I think of like superficial. So we have skin, and then muscle and tendon. As far as the skin goes, I'll show you here. This is what the incision looks like, okay? So overall, depending on the lighting and everything like with the camera, the incision looks really, really good. I've noticed as I started doing more, it started widening up just a little bit, which is kind of to be expected because now that I'm doing more, the skin is being stretched. Now, I don't have any adhesions, it's not adhered anywhere, which is great. I don't have any pain. The one spot it is kind of tender is right down here at the very bottom, where the incision was. Like, I didn't actually have any like surgical operation down here. It's just the incision. All my operation is like up here. Now, is it fully healed? No. The way you're gonna know, and I'm sure you've seen a scar at some point, it's gonna be white. So now I wanna move on to muscle. The muscle as a whole, muscles heal really, really, really well and fast. They're generally not the area of most concern. Muscles, the way they heal is they tear down and then they rebuild back up by throwing down collagen. The most important part of healing is not just laying down new collagen. And I say that because collagen adapts to the stresses placed upon it. So if we think naturally, collagen, these tissue, just lays down in an irregular fashion. It does this for one reason. It wants to be as strong as possible, as quickly as possible. So it's gonna lay it down in this kind of fashion. When you move, aka when you stretch and strengthen a muscle, it goes through its full range and it starts to break up and it starts to realign in a parallel unison where the fibers are aligned like this. That's how the collagen fibers should be aligned. Now, this whole process from this to this alone can take months, okay? It can take absolutely months for that entire process to occur. Just so happens that same process happens with tendons as well. The collagen is a little bit different and the role is a little bit different. In my case, the tendon is the most important part. Now, tendons are gonna heal slower than a muscle. So the muscle to me feels great. It feels as normal as I probably would have expected to feel. Now that I'm doing more, I start noticing that my tendon feels thinner and it feels more stress shielded. I'll briefly go over a tendon. A healthy tendon is along a spectrum. We have a normal healthy tendon on this side, and when it gets thin and weak, it becomes stress shielded over here. When it becomes like a thicker tendon, we don't want a thicker tendon. We want a stiffer tendon. It becomes thick when the body's trying to lay down excess tissue to make it stronger. When in reality, the goal was to focus more on the recovery, the nutrition side, the breaks between training sessions and training bouts, as well as like the sleep and laying off of things. That's when people start getting to overtraining side of things. So we want to come back here. Well, when you haven't been using a tendon for even as long as I have, because it wasn't on for 4 years, it's going over here to the stress shielding. So a lot of my therapy right now, that rebuilding, is getting my tendon back to a normal healthy tendon, which means I should be able to go do the exercises I need to do without having a deep or mild ache anywhere from 10 minutes after to 2, 3, 4 hours after. I should not have that. If so, then does that mean I'm doing too much? Maybe. It may just mean you're not giving enough rest and recovery in between each set. So maybe instead of doing 60 seconds between a set, maybe you do 90 seconds. And that's one thing that I'm having to do now. Which leads me to my point of common questions that I would imagine having with myself if I was my therapist. Which is around, therapy and training. As far as how we would progress your therapy or your training, really comes down to a VIF triangle. Okay, so if you're unfamiliar with VIF, V is volume, I is intensity, F is frequency. Essentially, when we create a program that is geared towards specific individuals, such as yourself, for myself, one of those levels of that triangle manipulates and changes what the focus is. So for example, for me, let's say my focus is I am going to train a total of 5 days a week. So if frequency's up here, and that's our locked variable, then we have V and I, or volume and intensity, down here, which is gonna dictate how much overall volume we can do, as well as how much intensity. And we're just gonna manipulate that triangle depending on what variable is the most important for you. Let's say it's total volume, and we're tracking the total volume. Well, then we figure out, okay, how many times a week or how many training sessions do I need to occur, as well as how many exercises that I need to go through with all the variables, the number of sets, reps, and all that I need to hit to optimize hitting the appropriate amount of volume without too much volume, which is the overall accumulation and load, and the I is going to be the overall intensity. So let's say if I'm doing something at a 50%, a 60%, 70%, 80%, 85%, 82, whether it's an RP of 8, an RIR of 8.5, any of those variables, that's going to dictate your intensity. And the cool thing is we can manipulate those variables, one, based off what science, and two, what is based off you, a person, or let's say in my case, me, a person, really wants and or needs. And that's what's really cool and makes therapy and rehab a lot more enjoyable for the process. Speaking of volume, overall, when looking at a volume in a rehab standpoint, we know we don't really want more than a 10% accumulation week over week of an increase. Like, we don't want to be going like more than 10. What we want to have is known as an undulation, which kind of means like some days you're going to come up, some days you're going to come back down, some days you might even go a little bit further back, or like weeks, you might go a little bit further back, and that is really to allow you to come back up. But overall, it's going to look like this, and if you zoom out, it's just kind of like this, and it trends in the right direction. And that's what rehab should be like. A lot of times I like to say, rehab is a lot like the stock market. You're going to have your daily ups and downs, but overall, it should be trending in the right direction. Most people understand that. And it sounds easy in theory. It's a lot harder in real life when people are used to, especially on the front end, making those newbie gains where they make progress really quickly, and it starts changing to more like this, and it slows down on more the tail end of rehab. So let's bring it back to like the things of what I'm noticing. So I'm really excited because I started doing some actual chest-based exercises. Okay, so things like a bottoms-up kettlebell where I'm holding something like this, fatigues quickly, but it's kind of cool being able to do. Doing some presses, things like that, and even tried a little bit of light like dumbbell pressing. It doesn't really feel comfortable. Like I don't trust it yet, if that makes sense. No pain, no issues. I'm not really fearful of it. It's just like internally, it's like I don't trust it. I feel a whole lot more comfortable with pressing overhead than I do like a horizontal press or a bench press, if you will. But I'll give you a real world example. As far as using the muscle at the end range, as you can tell, I have a harder time getting to that end range. Well, one of the things that I can start doing is progressing my arm in that position, this overhead position. And so one exercise that I've been doing personally is a jerk recovery. So if you're unfamiliar with jerk recovery, essentially you get into the bottom of a jerk position, and then you just stand up from there. And then from here, you just focus on the eccentric or coming back down, where I'm not getting any of the actual push through it, which has been really cool, because that was actually one of the things that I noticed the first time I actually tore it, doing that, and that started giving me a lot more comfortability inside. And two, one of the things that I've noticed the most muscle-wise is the subscap, muscle deep within. I feel like that has been one of my greatest limitations as far from the muscle standpoint, and learning to control and turning that muscle back on, if you will. And that's one of the things that I'm really doing it in the rehab side, to make my arm feel more comfortable in all positions as I slowly progress into training. So, and this leads me to like my final question, right? Or question I think I would have, which is, would I be able to fully return to activities? And if so, where am I along that progress, and if I'm happy with progress so far? And the answer is yes, you should be able to fully get back to all activities at 100%, okay? There shouldn't be any limitations. How long? Like I said, usually it's gonna be 6 months to a year, and that really depends on what your overall end goal is gonna be. Now, as far as me, okay, let's just imagine this is 100%, okay? So if this here is like 100%, this is 0. Prior to the surgery, I would have said I was probably about 64, 65%. I had the full range. I could do most activities that I wanted to, but there were a lot of things I couldn't do, and there were a lot of things that were really such a pain. Okay, like cooking sometimes, picking up things, hanging stuff up. I found my arm fatiguing very quickly and having a hard time doing stuff. Now, I would actually say I'm much further down, probably like at 40% range. Okay, you might look at my arm and be like, wow, that's probably looks a lot better than 40%. And it's true, could, depending on what the end goal was. So for me, there's two big things that I'm using as a judge of things that I couldn't do before that will allow me to see that I'm starting to go beyond what my prior to surgery levels were. And the two things are in the gym is one, going to be able to do push-ups. I've been able to do push-ups in over 4 years, going on 5 years now because of this. That's number one. Number two is being able to do a pull-up. Because both of those, being in that full stretch position and pulling, believe it or not, it pulls on that pec a whole lot. So those are the two main things that I'm gonna see. Like once I can start to do those and start doing them a little bit more comfortably, that is gonna see where I can start seeing the potential of all of this really being worth it, of going through everything in order to see the progress on the end of the line. Now, I'm 1,000,000% confident I'm gonna get there, but that is like my internal judge. As far as where I think I'm gonna get to my personal timeline, I think I'm probably gonna see that 64% range, that 64-65% range here in the next eight weeks or so. Okay, that's what I think. I think I'm gonna see it there, and then I think I'm probably gonna get to about 85% or so towards the end of this year, right? And that is, now maybe a little bit more, maybe a little bit less. I think the hardest part, once I get beyond that 70-75% range, is gonna be up here, far more than physical. It's gonna be the stress and learning to trust myself and trust the tendons, the muscles, and everything else in order to do their role and not give out. Because as you can imagine, or if you remember, and if you've seen, I didn't really have any warning signs. It just sort of happened. Luckily for me, it didn't hurt at all, but it happened. I knew what it was, and it sucked. Anyway, 4 months out, 16 weeks, super happy with the progress so far. I'm happy I've done it because I'm really confident I'm gonna go beyond where I was prior.